Hey everybody, Jennifer Schultz here. We're back with another episode of Oklahoma Health News, today powered by Oklahoma Children's Hospital here at OU Health. I'm very excited to have with me a very special guest, Dr. Harold Burkhart. Dr. Burkhart is the Director of Pediatric Cardiovascular Surgery here at Oklahoma Children's Hospital. He's also the Division Chief for Cardiovascular and Vascular Surgery for the campus, and you're a professor at the OU College of Medicine. So we are excited to hear a lot about cardiovascular health and about congenital heart disease today. So thanks for coming.
Well, thank you. Thanks, Jennifer, for having me.
You know, one of the things that always strikes me about Oklahoma Children's Hospital, it's such a special place. You see the smallest of patients, but you also see patients that have congenital heart disease that you will follow them for a very long portion of their life. Tell us a little bit about what congenital heart disease is.
Well, congenital heart disease, it can be a broad span of abnormalities or birth defects of the heart, and it's fairly common. It occurs in about 1 out of 500 births. So in Oklahoma, that's about 500 kids a year, and some of them can be minimal. They may hear a murmur and it may be insignificant and not amount to anything for that child through their life. And some they may need medicines and to be followed by a cardiologist their entire life. And then some may need further work like a cath-based procedure or a cardiac surgical procedure. And then those patients for sure would be followed by cardiology through adulthood as well.
Mm-hmm. So when you're thinking about, a lot of people might hear this as CHD, congenital heart disease. When you're thinking about CHD, what are the things that cause it?
Well, I think for the most part, most of it is caused by things we don't know. We do know that there's some sicknesses that mothers can have while they're pregnant that could contribute to it. Exposure to alcohol and tobacco may contribute to birth defects as well, and heart defects. As well as maybe genetics, and there's a small amount of genetics in it, but the overwhelming part of it is that we don't know the majority of the cause of congenital heart disease.
So is it something that it sounded like you said you could find out about this later in life. Is it something that you are born with that maybe becomes an issue later, or is it something that can develop over time for someone?
I think it's typically that you're born with it, and you find out about it later, or like you said, it develops, meaning it gets worse. You're born with a valve that has the propensity to get leaky, but isn't an issue until they're older. But I think in general they start with it, and it just becomes known as they grow based on the severity of the lesion.
Now I know there's a lot of moms and dads that watch, and so there's always that concern when you're expecting to have a healthy child. So as we talk about this, you know, there's probably a lot of questions of how do I find out if my child would be at risk for this? Is there a screening for it? How do you know? What can I do as a parent? Is there anything that they should be looking for or be considering to talk to a doctor about?
Well, there's a lot of things already in place, and first of all, having good prenatal care and having an ultrasound, and often the OBGYN doctors will pick up the birth defect on an ultrasound and then have a cardiologist that specializes in fetal imaging come in and do a specific echo just of the heart of the baby while the baby's still pre-birth. So that's the number one thing. Then once a baby's born, of course, you have neonatologists examining the child and listening to their heart and listening for murmurs, which may spark them to do further tests like get an echocardiogram of the heart or involve a cardiologist, as well as at every hospital where children are born throughout the state, they're essentially checking the saturations, the oxygen level, because if there was a low oxygen level, that would spark them to maybe look at the heart as potential cause. So there are a lot of things in place, and it's really just about educating everybody, letting them know that those things are out there to hopefully pick up on these things before their baby even goes home.
You know, I know for parents, there's always that worry about if, wanting their kid to be healthy and wanting their kid to have a active life. When you think about congenital heart disease, is there a survival rate, or does it really vary based upon the severity of the actual, what's going on?
I think for sure there are some cases where babies are born and they have a horrible situation and their chance of survival is quite low. But when you look at the whole program, and we're a large program, cardiac surgical program here, and you look at survival overall, it's 98%. So it's quite good. There's a good chance that you're going to do well with congenital heart disease at this time.
That's great to hear. You know, you had mentioned earlier that there's a lot of things that we don't yet know about why someone gets congenital heart disease. Is there research happening in the space to try to understand that? What does that look like, trying to figure out why someone might get congenital heart disease?
There's definitely looking at it from a genetic standpoint, and when we have certain families that have maybe multiple children that have congenital heart anomalies, there is a lot of research with regard to that. But there's also a lot of research going on with is there something that we can do to the heart, whether it's stem cell therapy, which we participate in, or other sort of interventions that may make that abnormal heart or abnormal muscle get better. But it's wide open.
That's great to hear. You know, one of the things that I always think about with Oklahoma Children's Hospital is that we have an incredible cardiovascular and cardiothoracic program. You are the leader of that. Tell me a little bit about the program itself and how you've designed it. And I know you came here several years ago to really build a program like this for Oklahoma. What does it look like for parents when they're thinking about needing this type of care?
Yeah, okay. I got here about 7 years ago, and prior to that, a good portion of the children in this state were going out of state for their heart surgery, because they're for the state of Oklahoma and 4 million people or so, they really just need one cardiac surgical program for the state to take care of that many children and adults with congenital heart disease. So the idea when I got here was to get an incredible group of expert people to support a congenital heart surgical program and cardiology program, so that every child in Oklahoma and every parent of a child with congenital heart disease could feel comfortable staying here in state. And I think we've ended up accomplishing that. We have results on par with any center in the country, and they don't need to go away and travel far distances to get their care from a cardiac standpoint, because you can imagine it's a real stressor on the family, not only having their child have heart surgery, but having to travel 4 hours to get heart surgery. We've been successful, but it's an incredible amount of people. The advantage of the Children's Hospital, and I like to remind people that we're the only children's hospital, freestanding children's hospital in the state of Oklahoma, and really consider ourselves the children's hospital for the state. And to do heart surgery at an institution like this, you need hundreds of people that have expertise in all these different things that could happen to this one patient in addition to the heart surgery. So you can't just go somewhere because they can fix a hole in the heart. You got to have everybody that's there that can take care of their child and make sure they have an incredible outcome and get home. So from my standpoint, there's no other place in the state, and there isn't. You can't get this anywhere else.
So a couple final questions. I always ask people when they come here if they have any words of hope or advice around COVID-19. I know for you, being a surgeon and seeing the tiniest of patients, what are some rays of hope or things that you think about with COVID that you'd love parents to hear?
Well, you know, we have stayed busy during COVID from a cardiac surgical standpoint, because these children have to have their surgery regardless or not. I will say that everybody has been understanding and gone by the rules and wore their masks and practiced social distancing. And I mean, I say what I tell everybody: we just need to keep doing this, and things will get better. And I'm optimistic. And from a COVID standpoint, it really hasn't affected the outcomes or how children have done with heart disease. And we just need to stick to it, hopefully another year, and then we'll have this behind us.
Well, thank you so much, Dr. Burkhart. Just in closing, I have to mention for our viewers that we've been working with some of your patients about telling stories of Oklahoma Children's Hospital, and we have a patient that said, I get to ride my bike because Dr. Burkhart helped me. So thank you for everything that you do. He's pretty sweet. So that's all that we have for today. We always tailor these topics to things that you direct message us or comment on in our Facebook section of our website. So we will be back again next week, and have a good one. Thanks.